So today's chapter is macrominerals, calcium, phosphorus, and magnesium. Those who have the textbook, please mention the page number in the chat box. Those who have the old textbook, the page number is 174. If you have a new edition, please mention the page number in the chat box. 179. The exams are going on for previous batch students. That's why we are having test participants today. Okay. So macrominerals, what do you mean by macrominerals? The minerals that you need in your body in large amounts. Okay, that is macrominerals. Whichever minerals you need in large amount. Okay, like calcium, phosphorus, magnesium, sodium, potassium, chloride, sulfur in thousands and all, more than 500 mg, 1000 mg. Okay, these are the amounts that you need these minerals in on a daily basis. Okay, so the amount is quite big as compared to other microminerals like iron, fluorine, selenium, cobalt, nickel. Okay, so as compared to those tiny amounts, these are quite big amounts. Okay, so that's why we call them as macro minerals. Okay, like, and the amounts that you need only in small amount, we call that trace mineral or micro mineral, like iron, magnesium, manganese, copper, iodine, zinc, cobalt, fluoride, selenium. Okay, we have discussed that. So calcium, an adult man, let's say if he's of 60 kilograms, has nearly 1 kg of calcium in their body. Usually it is stored in the hard tissues. 99% of calcium is found in the hard tissues like your bones, teeth, cartilages. Okay. Remaining 1% is found in your blood, circulating blood as calcium ions, in your soft tissues, in muscles. Even the muscles of the heart also require calcium because calcium helps in contraction. Okay. So the normal amount of calcium which should be present in your circulation is around 9 to 11 microgram per deciliter. That is the normal amount of calcium one should have in their blood. Okay. So now we will discuss about bone formation. That is the main function of calcium. It helps your bones to regenerate. Even it's not that when you're growing up, only at that time the bone is getting regenerated, you're getting taller. It's not that. Even during your adult life, right now, okay, many parts of your bones are getting regenerated. Some part is getting demineralized and other part is getting remineralized. This is an ongoing process which obviously slows down with aging. Okay, so if you focus in the on the slide here, okay, there are four major phases you can see starting from one phase. Okay, the first phase is osteoclast resorption. Osteoclast. Osteoclast. What does it do? Osteoclasts are responsible for taking out the minerals from the bone. Remember, osteoclast will make sure that resorption is taking place, not absorption. Resorption means retake of minerals that is already deposited in the bone. Osteoclast will take it away. Okay. So a dent is formed. You can see here. A major dent is not formed in your body. Minor dents are formed in your bone, okay, which obviously will get filled up. But if you don't have enough calcium supply, okay, these minor dents will become major dents and it will cause osteoporosis. Okay, but if you have a healthy supply of calcium, that will not take place. Okay, so osteoclast are cells that will pick up, okay, that will pick up the calcium, magnesium, phosphorus. These minerals will be picked up by osteoclast, okay, away from the bone, and it will be poured into the blood. Okay, so we can maintain an equilibrium in the bloodstream. That is the function of osteoclast. Now what will happen? There is a small dent you can see here. Okay. It should be like this in a resting phase, but now a dent you can see here. There is a groove. Okay. An indentation is formed here. So at the second phase, what happens is osteoblast phase. Osteoblast is the opposite of osteoclast. Don't get mixed up with the terminology. In osteoblast, what happens is that it will create a matrix. Okay, just like if you have seen a construction of a building. Okay, they lay down a matrix of iron rod and cement is filled into that iron rod. Okay, that matrix gives structure to the building. Okay, and cement is filled and cement is molded. Okay, into the shape of that iron rods or iron matrix. Okay, it's boxes and rectangles and all. So if you remember that, if you can identify that, osteoblast also does the same activity. Osteoblast is creating a matrix, and what is going to get filled up in the matrix? Any guesses? Osteoblast will create a matrix. You can see here an indentation was there, which was created by osteoclast, this groove. Okay, this zigzag kind of a groove. Okay, now a matrix is formed, a yellow matrix. If you can see, it's a beige yellow color. Okay, this osteoblast has given a matrix. Now what will get filled here in the matrix? Any idea, any guesses? You can put in the chat box. Yes, all the minerals. Okay, this matrix have been laid down by osteoblast so that now when the human body will absorb more minerals from the food, those minerals can come here and rest. Okay, will be mineralized. So matrix have been formed by osteoblast. Okay, now remineralization has started. Third phase is mineralization. Okay, calcium, phosphorus, magnesium, all these will come and settle here. Okay, they will mineralize the dent that was caused. Okay, the matrix, they will come and set here. Okay, so this is a new bone that has been formed. This yellow beige color that you see, which is in the process of being remineralized. We call this as a new bone or osteoid. Okay, and finally, after a few days, when it is completely mineralized, it becomes a mature bone. It's in a resting phase. Again, when the blood calcium levels drop, this will be osteoclast will come up, take the minerals away. Okay, then osteoblast will come, lay down the matrix. Mineralization will take place based on your food intake, calcium intake, magnesium intake. Okay, then finally a new bone will be formed. So this cycle goes on and on. But with aging, it slows down, because with aging, what happens is that mineralization takes time, because your body is not that capable enough to absorb calcium and other minerals to the extent where it was possible for it to absorb. Okay, during your young adult phase. With aging, the absorption rate goes down. So definitely mineralization rate also goes down. So a bone to become mature, it takes much longer time. So that's why osteoporosis and all, slowly osteomalacia, osteoporosis, losing the bone density, it's very common symptom of aging. Okay. So bone formation, is it clear? In a big paragraph, they have mentioned in the textbook. But if you just come back to this video recording, this slide, if you understand this slide, it's more than enough for you. You should just know the concept of bone formation. That is important. Okay, is it clear to all? Tooth formation. So this takes place when the child is yet inside the mother's womb. Okay, so this is the phase the function of calcium in tooth formation. The milk teeth that a child gets soon after birth, by 6 months of age, slowly the teeth will start coming up. Okay. So that formation has actually begun way early. Teeth starts erupting, milk teeth starts erupting much later after birth. But the formation of it has already begun when the child was in the fetal state, in the mother's womb. So, mother's calcium intake is directly proportional to the tooth formation of the child. If a child has a delayed tooth formation, means the mother was not taking enough calcium during her pregnancy. Okay. So, and also, after the child is born, how often it is fed, okay? And also the weaning diet that the mothers have introduced after 6 months of age, okay? When you have to stop the exclusive breastfeeding and start introducing weaning diet, okay? So the calcium content in the weaning diet, that determines the permanent teeth, okay? That determines how soon the milk teeth will fall off and how healthy permanent teeth will come. Okay. So that is the tooth formation. Calcium plays an important role in that. Then growth, we all know calcium is very important for growth because the bones have to lengthen. Only then the child will get its adult height. Okay. Then blood clotting, calcium, iron is one of a key factor involved in blood coagulation. There are around 13 to 14 factors, intrinsic factors we say, or blood clotting factors they are called. Okay. So these factors are very important in making sure that your blood clotting happens on time. You get bruised, you get a small cut and all, okay, and immediately within few seconds, your blood clotting should start, ideally. Calcium plays an important role in that. Calcium is one of the contributing factor that leads to blood clotting, blood coagulation. Okay. Then contraction of muscle, as I mentioned earlier, calcium helps in muscle contraction. That too, heart muscles as well, cardiac muscles as well. They help in shortening and lengthening the muscle fibers, which are very important for contraction. Then they function as intracellular messenger, okay, which means certain hormones, they exert their actions through the mediation of calcium. Okay, calcium, with the presence of calcium in the synapses, immediately, and not just the nervous system, but also in the regular cells, calcium, when it is around, okay, if one cell is damaged or one cell is attacked by a bacteria or virus, immediately the message is sent across because of the presence of calcium ions in and around the cell. Okay. So release of hormones, also facilitated by calcium, especially hormones like insulin, parathyroid hormone, calcitonin. Okay, the formation of calcitonin hormone itself requires calcium for your kidneys to release calcitonin, for your parathyroid glands to release PTH hormone, parathyroid hormone, for your pancreas to secrete insulin. Okay, calcium is required. Contact inhibition, that is, calcium does not allow the cells to stick to each other completely. Okay, calcium creates a kind of barrier in between two cells because calcium is required for the communication between two cells. So it inhibits the direct contact between two cells. Okay, it is present in the interstitial fluid between two cells. Then action on heart, again, similar to the contraction of muscles, calcium helps in the contraction of heart muscles as well. Then we have membrane integrity and permeability. Membrane integrity and permeability. Calcium ions, it influences the membrane structure and transport of water, and also the ions through it. Okay, not just the water, but also major ions which has to pass through the cells, outside the cells, which has to come inside the cells. Calcium controls that movement. Okay. Next is activation of enzymes. Enzymes like ATPase, which can break down the ATP so that energy can be given. So for energy also, calcium is required. ATP, adenosine triphosphate. Adenosine triphosphate. Okay. If it has to break down, it requires an enzyme ATPase. So adenosine triphosphate will become adenosine diphosphate. It had three phosphate ions, triphosphate. Adenosine had three phosphate ion. Now it will have two phosphate ion, diphosphate. Okay. So for this breakdown, ATPase enzyme is required. And when this ATPase enzymes breaks down the ATP, that's when energy is released. Okay. So in a way, calcium is also required for your energy. So functions, is it clear to all? Calcium absorption. So calcium requires this TRPV6. It's a channel, calcium channel. Okay. Through this specific channel, calcium will enter inside the cells of your intestine. Okay. TRPV6. That's a receptor. Okay. And it's a calcium ion channel. Especially, it is uh, placed in your microvilli of your intestine. So through this channel, calcium ions can enter the small intestine, the cells of the small intestine. Now, once it is in the small intestine, from one end to the other end, calcium has to travel, right? So calcium here requires protein. To enter, it requires this TRPV6 channel. Once it has entered, it further requires a protein. We call this protein calbindin, calcium binding protein, calbindin. Okay. So calbindin, it's a protein that will attach itself to calcium, that will bind itself to calcium, And with the help of this protein, now the calcium is able to move across the cell, go to the other end. Okay. And in exchange of magnesium, calcium will enter the blood circulation. Okay. ATPase enzyme is here that will help in this exchange. Magnesium is given out from the blood and calcium is taken in. Okay, in this through this exchange, calcium enters the blood circulation. Once it is inside the blood circulation, calcium will go and deposit itself in different bones. Okay, in cartilages, wherever calcium is required, it gets deposited. Is it clear to all? The absorption, calcium absorption, is it clear to all? Magnesium, in exchange of magnesium, calcium enters the bloodstream. Magnesium is taken away from the blood, calcium is given to the blood. Now coming to the favoring factors of absorption. What factors will help in the absorption of calcium? Presence of vitamin D. So when you eat a calcium rich food with a vitamin D rich food, okay, they are complementing each other's absorption. Not just vitamin D helps in calcium absorption, but calcium also helps in vitamin D's absorption. Okay, they both complement each other in absorption. So the presence of vitamin D is very important for calcium absorption. Okay, so that's why milk is a really good source of calcium. Why? Milk also has vitamin D. In a single source, it has vitamin D and calcium. Milk is an amazing source of calcium absorption. Then acidity of the digestive mass after food after coming out of your stomach, okay, it should be acidic. And also once it enters your small intestine, the intestinal secretions also should be acidic. Okay, so when this digestive mass of food enters the intestine along with the acidity that is bringing from the stomach, even in the intestine it is getting more acidic. That's an ideal situation for calcium absorption. Then the presence of lactose, which is definitely present in milk. Okay. So lactose is a carbohydrate which you get from animals. Lactose is the only carbohydrate that you get from animals through milk. Okay. So the presence of lactose also helps in calcium absorption, which is present in breast milk as well. So the initial 6 months calcium source is mother's breast milk, because mother's breast milk also has vitamin D and lactose. Okay. So in these both ways, calcium from mother's breast milk is completely absorbed into the child's body. But lactose also has a time frame. Usually it works really good for infants. Okay. Once you are a toddler or a young child, lactose will not play much of the role in in the calcium absorption. Okay. Then protein and phosphorus. Presence of protein and phosphorus both helps in calcium absorption. Okay. So usually non-vegetarian food, milk, which has lactose, which has vitamin D, which also has protein. Okay. So that's why milk is a very ideal source of calcium. And if you're mixing ragi, you're making ragi porridge in milk. Okay, ragi is a good source of calcium, but its bioavailability is very low because it is a plant-based source. Okay, ragi has calcium, but majority of the ragi's calcium is not absorbed by the human body. Okay, it is lost. But if you milk ragi with milk, okay, the presence of vitamin D, protein, lactose present in milk enhances the absorption of calcium from ragi as well. Okay. And also phosphorus, the presence of phosphate in the diet has an effect of calcium absorption. Then the last factor is your need for calcium. In pregnancy, the need is higher. In during lactation, it's the highest. Okay, more than in pregnancy. It's during lactation a woman requires the highest amount of calcium intake. Okay, why? Because there is a need. There is an increased demand because the body is producing milk. The breast is producing milk. So more calcium is required to produce milk. Okay. So instead of the mother depreciating her own calcium reserves, if she is having enough from the food, she will not lose her bone density. Okay. So that is the need for calcium. Even during the growing phase, when the child is growing up, okay, in those phase as well, the need for calcium is high. Now coming to the factors that are depressing the calcium absorption, factors that reduce the calcium absorption. First is oxalic acid, the presence of oxalic acid, which are found in legumes, in pulses, in spinach, okay, green leafy vegetables. Some seeds and nuts also have oxalic acid. So the presence of oxalic acid, just like iron, calcium absorption also goes down. Then phytic acid, presence of phytic acid in wheat, whole grains, cereals, bread, okay, that also impacts the calcium absorption, reduces the calcium absorption, okay, because it will react, oxalic acid, phytic acid, they will react with the calcium to form calcium oxalate, to form calcium phytate, which are precipitates. Precipitates will not dissolve. Precipitates will not be absorbed. The only way the precipitates leave your body is through excretion, feces, okay. Then steroria, in steatoria, too much of fat your body loses through excretion. Why? The body is not able to absorb properly. Okay, the body is not able to absorb properly. So the lipids, a lot of fat globules in mass density, it is lost from the body. That is steatoria. So not just calcium absorption, all the vitamins and minerals absorption will be affected. Okay, people who are suffering from diarrhea, steroria, okay, all the vitamin and mineral absorption will be affected. Then emotional instability, tension, stress, anxiety, grief, boredom, okay, they all can interfere with calcium absorption. Usually stress during exams and all in students, okay, it will reduce the calcium absorption. Then increased GI motility, that is diarrhea, okay, or you are consuming too much of fiber in your diet, that you are losing a lot of minerals and vitamins through the bulk of the feces that is created. Okay. Next is lack of exercise, sedentary life, no, not engaging in weight bearing exercises. Okay, people who are bedridden, who are in a coma, unconscious, bedridden for a long time, they may have multiple fractures. Okay, there is immobility. So these things can reduce the calcium absorption. And aging, as I mentioned, with age, your intestinal motility, the intestinal absorption rate, everything slows down, goes down. Okay, so calcium absorption also goes down. Too much of caffeine intake, too much of caffeine intake can also affect the bioavailability of calcium. Yes. Some medications like anticoagulants, as I mentioned, calcium is an important factor which comes to play in your blood clotting process. So if you're taking anticoagulants like heparin and all, okay, that can inhibit the calcium absorption. Cortisone, steroid medications. If you're taking thyroid medication, okay, we suffer from hypothyroidism and you are prescribed on levothyroxine. Levothyroxine is a commonly prescribed thyroid tablet. Okay, so if you're on thyroxine, that can also inhibit the calcium absorption. So all the factors that are depressing that reduce the calcium absorption, is it clear to all? What is the metabolism of calcium? Once it is absorbed, what will happen to the calcium next? We have seen how it is absorbed, which factors can enhance calcium absorption, which factors can reduce calcium absorption. Now, once it is in the blood, it has been absorbed, and from the intestine, it has reached into the blood. Now, what will happen to the calcium? Okay, so it will be transported by the blood to extracellular fluids. As I mentioned, calcium should be there in between the cells so that the cells will stick to each other. Calcium will be the mode of communication between the cells. Okay, so it goes into the extracellular fluids, which stays outside the cells, interstitial fluids. Okay, cells take calcium from the ECF, extracellular fluids. Whenever the cells require calcium, it will grab it from the extracellular fluids, interstitial fluids, okay, and put it inside the itself. And then 99% of calcium is reabsorbed in the kidneys. Wherever the blood will go, those blood will go to the kidney as well for filtration. Okay. Kidneys will not filter out calcium. Kidneys will try to absorb the calcium back into the bloodstream. Kidneys will not take away the calcium. Kidneys will take the calcium, put it back into the bloodstream. Okay, so 99% of calcium through blood, if it reaches kidneys, it is also going back into the bloodstream. Okay, and mostly this 99% of calcium which the kidneys have given back to the blood circulation, they will get deposited in the bones. Okay, that will be used in the calcification of bones, mineralization of bones. Is it clear to all? Metabolism. Next is hormonal control. So parathyroid hormone, it will decrease the whenever the calcium ion is down in blood. When the blood calcium ions go down, parathyroid hormones get activated because parathyroid hormones will go and cause the cause the bones to give out calcium. So parathyroid hormone decreases the calcium from the bones. Okay. As soon as the calcium ions go down in the blood, okay, immediately secretion of parathyroid hormone will start. Within minutes, calcium will be picked out from the bones, okay, and it will also be taken up from the kidneys as well, put it back into the blood to bring back the blood calcium levels to the normal range, okay. Then calcitonin, which is released from the thyroid gland. So whenever the plasma calcium levels are too high, the opposite case, when it goes down, it's the parathyroid hormone. But when calcium levels are too high, that's when calcitonin hormones comes to play. They will release phosphorus and other minerals into the blood. Okay. And calcitonin will make sure that the blood takes the calcium and deposits it back to bone. So the blood's calcium levels are normal. Okay. Parathyroid hormone is taking it away from the bone. Calcitonin is depositing it back into the bones. Okay. Then vitamin D. Vitamin D is a only vitamin that acts like a hormone. Vitamin D is in a specific state. Okay. 125 dihydroxy vitamin D. Okay. That acts like a hormone. So whenever calcium deficiency, if you are facing calcium deficiency, vitamin D in its active form is absorbed more by the intestine. Okay. So that from the kidneys also calcium can be absorbed back more in quantities and bone formation can take place. So vitamin D helps in that control. Okay. When calcium levels go down, vitamin D will be secreted more because we want to enhance the calcium absorption. Then cytokines, they are cells found in the blood and also around the cells, normal cells. They are part of your immunity. Cytokines will keep track of infections around that is happening around the body. Okay. So immune cells, they produce lymphotoxin, tumor necrosis factor. Okay. So these are the cytokines that produces these toxins and other factors that can promote bone resorption. Okay, that can promote bone demineralization. Okay, because these factors to be produced, calcium is required. So cytokines also have an important role in making sure that your normal bone is being remodeled again and again. Because these toxins has to be produced, cytokines will make sure that the bone mineralization, remineralization keeps happening again and again. Okay. Then osteoporosis we will discuss in the chapter of vitamin D in detail. Okay, osteomalacia, osteoporosis that we will discuss there. So hypocalcemia is a term, it's a medical terminology. Medical terminologies are important for you. Okay. Hypocalcemia is a condition in which you don't have enough calcium, okay, in your blood. In your blood, the calcium levels are very low because you are not having calcium in your diet, or even if you're having enough calcium in the diet, it is not getting absorbed properly. So your blood lacks enough amount of calcium. So that condition is called hypocalcemia. So if somebody has a hypocalcemia, they will have issues with the muscle contraction. Automatically, the muscle will contract here and there. Out of like even when you are not doing anything, you're sitting, but sometimes your eyes start twitching. Okay, some part of your body, the muscles will start twitching on its own. Okay, you don't have control over it. Automatically, it starts twitching. Okay, so that's a sign of hypocalcemia. You don't have enough calcium. Tetany. Okay, the muscles will go into a state of contraction. Usually at night it happens. Okay, in the calf of your legs. Okay, the muscle. मतलब in Hindi we say नस पकड़ लिया, something like that. Okay, muscle पकड़ लिया. So that is what is said. Okay, at night usually it happens. Again, it's a sign of low calcium. Okay. Paresthesia. Paresthesia is a sense of numbness, tinglingness and numbness at the tips of your fingers, tips of your toes, tongue, okay, in feet, lips. In this area, you feel kind of numbness, or sometimes it is a tingling sensation. If you feel, that's a sign of hypocalcemia. Hypercalcemia, too much, just the opposite. Too much of calcium in your blood, more than the required amount. So, what are the symptoms here? You may have anorexia, not feeling like eating anything, nausea, vomiting, constipation, abdominal pain, etc. These are the calcium rich foods indigenous to India: okra, that is bindi, dates, oats, oranges, chia seeds, green leafy veggies, nuts, banana, sesame seeds also. It's not mentioned here. Sesame seeds, gingerly seeds. Okay, these are good sources of calcium. Phosphorus we will do next time, next class.